Hello, welcome to class. I hope you guys all had a good Christmas break. So I just wanted to talk to you a little bit about this class. I know that you have this class in conjunction with your clinical class, and you also have a pharmacy class. So part of what we do this semester is we join forces with pharmacy, and we align the systems that we're reviewing, the disease processes, with the drugs that go along with them. And each week you'll have an assignment that gets grades in both classes. So you will get a disease process assigned to you, and you will complete what we call a diagnosis sheet, and there are samples of diagnosis sheets in your module. And you will put the drugs at how you treat that particular diagnosis. The disease process part of it will be graded in my class. The drug part will be graded for your pharmacology class. All right, so let me just take a look at what we're doing in this class. Okay, so each week you guys have a quiz. Now the quiz questions are straight from the Fitzgerald's review questions for your state board or your board exams, okay? So I would like for you to do these questions. I think it would be immensely helpful to you to do these questions. They are on the systems you're doing, so that if you don't know the question, you can go back and look up the information to make sure you do. But they're not graded. So if you do them, that's up to you. I would think it'd be a good idea. I would highly suggest you do them as preparation for your midterm and final. But like I said, that's up to you whether you do them or not. You will have a SOAP note each week, and this is for a couple of different things. One is to get you familiar with the SOAP note format, to get you thinking in the process, in the logical process that SOAP notes are done in, and get you thinking about how you as a provider would take care of these people in these certain situations. All right, so we talked about the diagnosis sheet, the SOAP note, and the quiz. For the musculoskeletal midterm, each of you will produce some sort of PowerPoint, lecture, film, live demonstration, whatever, that you will present live in front of your peers during the intensive. This will be 50 points of your midterm grade. Okay? So you are already in groups. They've already been assigned. You should be able to find that under the groups page. Look under people, look under groups, and you should find your groups there. Alright, so then you will also have a midterm and a final. This is a very busy class, but this class this year is general primary care across the lifespan, introduction to a lot of chronic illnesses, but pretty much the only class you're going to get most general primary care type things. Okay. Then next, during the summer, we'll do women's health and pediatrics. And then during next fall, you'll do somewhat of a GERE chronic care class. I do have 2 of your shadow health modules in here. There were some disease-specific cases in your shadow health, and I did include 2 of those in this class. I did it because I thought you would like it, and it's kind of we'll break up the SOAP note type thing a little bit, but you know, if somebody is really, apparently some people really didn't like shadow health, and that's fine. If you didn't, then I will assign you another SOAP note. Anyhow, let me know what you're thinking. Now, this does seem like a lot, and it is a lot. I'll grant you that. If you did, like I said, the quizzes are optional. I would highly recommend them, but they're optional. If somebody goes and thinks that the SOAP notes are just absolutely a waste of their time, you can opt out of SOAP notes, but you either opt out of them all or you opt into them all. You can't do both ways. And then your midterm and final will just count as 50% of your grade and 50% of your grade minus the 50 points you get for the musculoskeletal module that you do during midterm, during your intensive, which is not optional. Okay? So you have the choice of either doing a lot of low stakes things that I really think will be helpful, or if you really feel like that's not the way you study best and you would rather just read everything and take your midterm and final and just use those as basically your only 2 grades for the class, except for the intensive. That's okay with me, but you need to let me know this week, and once you opt out or in or whatever you call it, you can't change your mind, okay? So this is you get this week to decide if you want to do that on a personal level, and we can make that happen. That would not be my suggestion, obviously. I think that having lots of low stakes and getting lots of information and being forced to look over lots of different things is more important. On the diagnosis sheets, you're all assigned one particular diagnosis. If you guys want to work together, I don't care, but you still need to produce one diagnosis sheet per student. So if you want to work together and somebody look up the pathophysiology of 2 of them and somebody look up the differential diagnosis, or however you decide to do it, that's fine, but you both need a unique diagnosis. Okay? All right, and anyways, I hope this helps, and make sure you do fill out your introduction post. Thank you.